Inside a hospital, the steady beep of a heart monitor is usually accompanied by an erratic green line racing across a dark screen. To an untrained eye, this looks like a stream of unreadable, high-stakes medical data. But for a medical professional, the chaos disappears. That jagged line is a legible clock, ticking away with absolute mathematical precision. The challenge is understanding how to look at those squiggly lines and extract a precise, life-saving metric like beats per minute. This analysis doesn't require a complex medical breakthrough. It relies on applying basic geometry to a standardized grid. Standard ECG paper is a mathematically precise timeline. Every large square and tiny square inside it represents a fraction of a second. Plotted along this timeline is a sharp upward line called the QRS complex. This spike is the visual representation of a single human heartbeat, specifically the moment the heart's lower chambers contract. To find the heart rate, focus exclusively on the horizontal empty space existing between one spike and the start of the next. Understanding the grid's timescale converts this medical document into a set of measurable geometric intervals. To navigate these intervals accurately, clinicians use a specific decision tree. This mental map ensures that the correct mathematical formula is applied to each patient's unique rhythm. The first step is to verify the distance between the spikes. If the physical gap between every beat is identical, the rhythm is predictable, and we move down the regular branch of the tree. If those gaps vary in width, we must take the irregular branch, which requires a different approach to measurement. Identifying regularity correctly is the most important diagnostic pivot point. The wrong choice here will invalidate every calculation that follows. On the regular path, perfectly even gaps allowed for simple division to determine the heart rate. For a quick visual estimate, doctors use square counting. They count the heavy grid lines between two spikes and follow a memorized sequence: 300, 150, 100, 75. This trick is powered by the 300 method. You count the number of large boxes between two beats and divide 300 by that total. 4 boxes between spikes results in a rate of exactly 75 beats per minute. Since heartbeat spikes don't always land perfectly on a heavy grid line, the 1500 method provides higher precision. You zoom in and count the individual 1 millimeter squares between the two spikes. Dividing 1500 by that precise total gives you the exact rate. For regular rhythms, heart rate is a simple byproduct of the grid's geometry. You choose between large boxes for speed or small boxes for accuracy. The irregular branch covers chaotic rhythms, like atrial fibrillation. Here, the distance between beats changes constantly, making the previous formulas unreliable. When we can't rely on the distance between two specific beats, we look at an average over a set block of time using the 6-second method. We isolate a block of 30 large boxes on the grid. Since each large box represents 0.20 seconds, 30 boxes encompass a window of exactly 6 seconds. Next, we count every heartbeat spike that falls within that specific 6-second window. Multiplying that total by 10 scales the 6-second snapshot into a full minute. 14 spikes in that window results in an average of 140 beats per minute. By zooming out, the 6-second method accounts for the localized gaps and provides a mathematically sound average for an erratic heart. We can apply this entire process to the strip in this doctor's hands. The gaps between the spikes are identical, confirming a regular rhythm. Counting the large boxes between beats shows 4 squares. 300 divided by 4 gives us an immediate rate of 75 beats per minute. This process replaces the initial confusion of seeing these lines with a structured step-by-step analysis. Even a century ago, when ECG machines were massive desk-sized devices requiring saltwater baths, these same geometric principles were used to interpret the heart's activity. Now, try it yourself. I'm putting an irregular ECG strip on the screen. Use the 6-second method to calculate the rate and leave your answer in the comments. Analyzing an ECG shows that even the most complex heartbeat patterns can be understood using simple observation and basic division.